Good morning. Good morning. Welcome to the full Committee of Health and Human Services. I'm your chair, Delegate Rodney Willett. Great to have everyone here this morning. We got to catch our breath a little bit after a very busy week last week, but we're back now with Senate bills, and we're going to move through quite a few of those today, and then have one of our committees meeting. Health professions will be gathering right after we finish up here this morning. So with that, we will take the roll. Okay, and we've got a quorum. Excellent. So I'm going to start. We've got a few bills that came our way that actually need to go to other places. So I'm going to work through 4 bills this morning, and what we'll do is just to get a motion and then a voice vote to refer these. So the first one is SB 64 from Senator Favola. We want to refer that to public safety. The motion's been properly seconded to refer SB 64 to public safety. All in favor say aye. Aye. Opposed, no. The next, catch up.
Takes me a minute.
Yeah, I'll do that. And the next one we have SB 225 and then also SB 642. So the first one is from Senator Serville. The second one is from Senator Pillion. And we need both of those to go to Labor and Commerce. Motion and second to refer to Labor and Commerce, SB 642 and SB 225. All in favor say aye. Aye. Any opposed? No. We'll refer those. And then last but not least, we have SB 258 from Senator Pekarsky. That needs to go to General Laws. Motion and a second to refer to General Laws, SB 258. All in favor? Aye. Any opposed? No. Okay, so we've taken care of all of those. Next up, we've got a block of bills from the Senate. These are all have House cognates, or vice versa, if you want to say it that way. I think we've all got those listed here. I'm just going to ask the members of the committee, anyone have any issues with voting these in a block? Anyone you want pulled out? We good? Okay. So I guess I'll read these 1, 2, 3, 4, 5, 6, 7. Yeah, we've got about 9 or 10 of these. So I will read these, and then we can just make one. We'll do one vote to advance them. So we have, let's see if I can do the corresponding. Yeah. So SB 194 from Williams-Graves, electronic death registration system requiring applicants licensure to complete training. SB 212, Senator Boysko, related to Schedule 6 controlled substances, an optometrist being permitted to dispense those. SB 239, Senator Head, State Health Services Plan Task Force designate areas of state in need of additional project. SB 247, Senator Favola. This is related to one of my bills, the nursing home change of operator licensing and what they have to do there with a change of operator. SB 513, Senator Deeds, Comprehensive Mental Health, Substance Abuse, and Development Disability Crisis Services Written Plan. Next page. Senator Deeds again with SB 514, the Marcus Alert Evaluation Task Force, creating that. SB 608, Senator Pillion, Peer Recovery Specialist, VDH and DOC to develop guidelines for hiring. SB 641, also Senator Pillion, office-based buprenorphine treatment, Board of Medicine to amend its regulations to allow that. SB 706, Delegate Srinivasan, opioid antagonist distribution program report. So we have that block, and with no questions, we will go on the board to approve all of those reporting. Second. We have a motion that's been properly seconded to report the block, and then we'll go on the board. And that block of 9 bills reports by a vote of 15 to nothing. Okay, thank you, committee members. And then we have a couple of bills that also were identical with House cognates, but these had some no votes early on, so we pulled these out separately. And And they're just two of those. Yes. Yeah, just two of those. So I'm going to start with, I guess just do these individually. SB 178 from Senator Locke, related to additional authority for dental assistants to do certain types of scaling and policy. Second. We have a motion that's been properly seconded to report SB 178, and we'll go on the board. And SB 178 reports by a vote of 10-5. And then one more bill in this category, again, where there was a contested vote. This is SB 722 from Senator Williams Graves, and relates to the, as we had a great presentation from Delegate Hernandez on the open captioning requirement for motion picture theaters, movie theaters. We have a motion that's been properly seconded to report. Okay, we're going to pause for 1 second. We're getting the system back up. Here it comes.
Okay, this is the last one. Hang on 1 second.
Okay.
Let me pull up the next one. Okay, report.
Yeah, so again, motion has been properly seconded to report SB 722. That's coming up.
It's slow today.
A little slow.
I just stuck it on first.
There we go.
It's coming back. It came back. So just it's coming back. Okay, thank you. Appreciate it.
And SB 722 reports by a vote of 13-2. Okay, thank you, committee members. All right, our next category, these are Senate bills with not identical, but similar House cognates, and we'll go through these individually. The long and short of it is some, I think there's a recommendation just to report them just as is. Others, we will have a substitute to get them into conformity with the House cognates. So I'm going to start with Senate Bill 22 from Senator Locke. This is related to bias reduction training as required through the boards of medicine and nursing. We've heard that before from Delegate Hayes. And the recommendation here is just to report that one as is. We have a motion that's been properly seconded to report SB 22, and we'll go on the board for that one. And SB 22 reports by a vote of 12-5. Next up, we have SB 75 from Senator Lucas. This is related to retired law enforcement officers being able to provide the emergency and temporary detention transportation. And the recommendation there was to basically make this conform to the House bill via substitute. Chandler, do we need you to report the substitute on that or share the substitute?
Mr. Chair, yes. So SB 75 from Senator Lucas is similar to HB 681 from Delegate Hayes and HB 976 from Delegate Price. So HB 681 deals with the retired law enforcement officer component of SB 75, and those related provisions of SB 75 are identical. HB 976 deals with the alternative transportation portion. Substantively, the two bills are identical, but HB 976 organizes the new language a little bit differently and contains some technical changes that improve readability. So SB 75 would just need a substitute to conform to the alternative transportation portion of HB 976.
Second.
We have a motion that's been properly seconded to report the substitute. All in favor of the substitute, say aye.
Aye.
None opposed. Okay, so we have the substitute before us, and if there are no questions, we will go on the board to report SB 75 with substitute. And that reports by a vote of 17-0. Next up, we have SB 133 from Senator Locke. This is related to newborns and children in the Department of Social Services to study services to address parental prenatal substance abuse issues. Same recommendation here, and that is to have a substitute to make this conform. Chandler, I ask any significant changes there?
Mr. Chair, no significant changes. Once again, this bills are substantively the same, and conforming just requires a substitute that makes technical changes to match HB 652.
We have a motion that's been properly seconded to move the substitute. All in favor say aye.
Aye.
Any opposed, no. And so now, with no other questions, we have motion to, we will report SB 133 with substitute. And go on the board. And that reports by a vote of 14-3. Thank you. Next up, we have SB 248 from Senator Srinivasan. This relates to food allergy awareness notices in restaurants. This needs an amendment to make it conform. And Chandler, you want to describe that amendment?
Mr. Chair, yes. So the bills are functionally identical once again. These are two very small changes to conform, which are the removal of a comma on line 25 after the word food and capitalizing the word internet at the beginning of line 33. And that's it.
Oh, my goodness. Crazy. We have a motion that's been... We have a motion that's been properly seconded to move the amendment. All in favor say aye. Aye. Any opposed?
No.
I think I heard one no there. There's always a big debate on whether you capitalize the I in internet, so we've gone over that. If there's no other discussion, I'll take, actually, yeah, move to report. We have a motion that's been properly seconded to report with amendment, SB 248. We'll go on the board. And that reports by a vote of 11-6. Okay, next up, we have SB 282 from Senator Aird. This is related to the licensure for dental hygienists. Dental hygienists being able to practice in a foreign country or jurisdiction, being able to practice here. Once again, we need an amendment to make this conform, and Chandler will have you describe the amendment.
Mr. Chair, in HB 1036, the subcommittee changed the language to was or is eligible to practice as opposed to just is eligible to practice. So this can be conformed to the line amendment on line 28 after Romanet 2, just adding the words was or.
Move the amendment.
We have a motion that's been properly seconded to move the amendment for SB 282. All in favor say aye. Aye. Any opposed, no. If there are no other questions about SB... We have a motion that's been properly seconded to report with amendment, SB 282, and we'll go on the board. And that reports by a vote of 17-1. Thank you. And then another bill from Senator Aird. This is SB 291 related to the State Board of Health standards of care for neonatal care, same bill that I carried. In the House, we need an amendment to conform those, and Chandler, I'll come back to you.
Mr. Chair, we will need an amendment in the nature of a substitute to conform SB 291 to HB 456. The body of the bill has one small difference. HB 456 directs hospitals to establish standards that are consistent with but not necessarily identical to the American Academy of Pediatric standards. But SB 291 says consistent with but not identical to. So we would have to add the word necessarily to make that match. Additionally, there's difference in enactment clauses. So SB 291 has one enactment clause with a delayed effective date of July 1st, 2029. HB 456 has two enactment clauses. First directs Board of Health to promulgate regulations to implement the bill by July 1st, 2027. And the second prohibits enforcing such regulations until July 1st, 2029. So the bill can be conformed with a substitute that adds that word and replaces the enactment clauses.
We have a motion that's been properly seconded to move the substitute. All in favor say aye. Aye. And no one opposed. So that we have the substitute before us. If there are no other questions, we'll take a motion to report that.
Move to report with substitute. Second.
The motion has been properly seconded to report SB 291 with substitute.
Amendment, yeah.
Substitute.
I'll
With
fix- I'll
substitute.
fix it.
So we've got it right. Thank you. Thank you,
Okay.
Chair Price. So with substitute, and
I'll fix it later.
we'll go on the board.
Should she fix it now?
I-
So that we-
Yeah, hang on, let me fix it.
Yeah, hold on
now.
a second. We're going to destroy that rule. We're going to put that back up again with the substitute. So hold tight 1
Yep,
second.
hang on, sorry, guys.
That's all right.
This is,
291. Yeah, good catch. Okay, now we got it with the substitute. We'll go on the board. And SB 291 reports with substitute by a vote of 20-0. Okay, next up we have SB 308 from Senator Pekarsky related to drug overdose deaths and BDH, the Department of Health developing a plan for opioid response. We need a substitute for this one, and Chandler, we're back to you.
Mr. Chair, you might be noticing a trend here. These two bills are substantively identical, but there are a few technical changes that are necessary to conform the bills. Namely, this is the inclusion of the word report in the title, adding the word overdose after opioid on line 9, and changing Secretary of Health and Human Services to Secretary of Health and Human Resources on line 13 to align with what we call that secretariat in the Commonwealth. So these edits can all be incorporated into a conforming substitute.
We have a motion that's been properly seconded to move the substitute. All in favor say aye. Aye. Any opposed? No. If there are no further questions, we'll take a motion to report.
Second.
We have a motion that's been properly seconded to report with substitute, SB 308. We'll go on the board. And that reports by a vote of 20-0. I'm going to do two more bills that just have minor changes, and then we have Senator Carol Foy with us. I'll get right to her. So let's go ahead and do, and we're trying to get Senator Favola here as well for her bill. So let's do SB 379 from Senator Boysko. This is the psilocybin bill from the Board of Pharmacy having to reschedule that to put that on the schedule. I guess that's how that would be phrased. There were no changes to this, and I think the recommendation is just to report that as is.
So moved.
Second. We have a motion that's been properly seconded to report SB 379. We'll go on the board for that. And that reports by a vote of 20-0. And I want to go to SB 677. This is from Senator Head. This is exempting certain restaurant facilities or programs from regulations. Once again, we need a minor amendment to that to get it to conform to the House bill. Chandler, what's that amendment?
Mr. Chair, this bill could be conformed with the line amendment on line 48 that just replaces the phrase home-based child care with the phrase family day home as defined in section 22.1-289.02.
Okay. We'll take a motion to move that amendment.
Move the amendment. Second.
Okay. We have a motion that's been properly seconded to move the amendment. All in favor say aye.
Aye.
Any opposed, no. If there are no other questions, we'll take a motion to report that as amended.
Second.
We have a motion that's been properly seconded to report as amended, SB 677. Go on the board. And that reports with amendment by a vote of 20-0. Okay, now we will get to SB 596. We have Senator Carol Foy with us. This is a bill we've seen before, and we want to get as close as we can here to make this work. So, Senator, great to have you with us this morning.
Good morning. It's great to be here. Mr. Chairman, members of the committee, Senate Bill 596, the right to contraception, it is the cognate of House Bill 6, carried by Delegate Cia Price. In my version, there are a few differences that we put in the bill in conjunction with Planned Parenthood. So if the committee would like for me to go through the differences between the versions, or if the committee so chooses to lay House Bill 6 atop of my version and then we'll work it out in conference, I'm amenable to whatever the will of the committee is.
I'm going to defer to the chair.
Thank you, Mr. Chair. I did have some questions for the senator about one of the amendments that was agreed to that I'd like to work out in conference. So if we could, I'll move to conform Senate Bill 596 to House Bill 6 and move that substitute.
Second.
We have a motion that's been properly seconded to conform with substitute SB 596. First to move this, all in favor of the substitute, say aye. Aye. Any opposed? No. Okay, so that is before us. Any other questions? We'll work this. Looks like we'll move towards conference to get this right. Super important bill, and I really appreciate you bringing that. Certainly appreciate the chair bringing that. We'll get this finalized. Get a really important bill.
Second.
We have a motion that's been properly seconded to report with substitute SB 596, and we'll go on the board. And SB 596 reports with substitute by a vote of 14-6. Senator, thank you so much for being with us.
So much.
Thank you. Committee members, we have done a great job getting through our agenda this morning. We have one other bill that's on the agenda. We're trying to get Senator Favola here. She actually had to chair her version of this committee this morning, so we're definitely trying to be in. What's that?
There she is.
And she walks in the door. That is amazing. Senator Favola, if you need it, we'll give you 2 seconds to change gears here.
I think you want to hear about Senate Bill 332.
That is it. Come on up. You have an impeccable timing, and we did use the word amazing as you walked in the door. I just want the record to reflect.
Just luck.
No, that's
Pure
good.
luck.
Thank you for being with us this morning.
Thank you. Thank you, colleagues. I have a substitute to Senate Bill 332. I did work with Delegate Keys-Gramara. This does have to do with medical cannabis, but I would first ask that you adopt the substitute.
Second.
We have a motion that's been properly seconded to move the substitute. All in favor say aye.
Aye.
Any opposed, no. So that's before us. And do you want to talk? Why don't you just talk?
Do you want me to talk about it?
That'd be great. That'd be great, Senator.
Okay. Well, what this does is very simple. It does allow for the use of oil cannabis in hospitals. We can currently use oil cannabis in nursing homes and other clinics. And then it sets up a work group to evaluate the possibility of other use of other types of marijuana products, if you will, and how that would relate to the Federal Controlled Substance Act. And there's a report due back to the General Assembly on November 1st, 2026, so we may be able to expand usage depending on what this report says. But clearly, oil is already allowed in many facilities, and we just added hospitals. This has the support of the HHA and MSV, and of course a number of other groups that care about palliative care.
Excellent. Any questions from the committee for the senator? Yes. Chair Price.
Yes, thank you. Hello.
Hello,
Senator, I just had a question because I know in some of the conversations we had with the other bill, it was various forms not to include botanical or things that vaping or smoking. Would you be amenable to that also including gummies, or I guess some of the other words were tincture, or were you just keeping yours to oil?
It was, well, the work group is really tasked at looking at a number of other options, and so that's where we put it. Right now, the criminal code protects any usage of oil, so that was our guiding light for the moment, but the work group is quite, the language is broad in terms of what they will cover. But thank you for asking that.
Great. Any other questions from the committee? And again, I thank the senator for bringing this to us this morning. Chair Tran.
Mr. Chair, I think it seems like there are some differences with the version that we passed out of the House, and I think there's a few of us who believe that we should conform to the House version so that we can get these bills into conference.
The intent was that Delegate Keys-Gramara is not here, that she was also going to offer this substitute in the Senate so we could avoid conference.
Okay.
But we worked on this yesterday. I she's not here, but
Yeah.
I can tell
I think
you
I have that note.
we had a meeting, and so this was our goal to sort of avoid conference, and we're both very comfortable with this.
Yeah. And I should have shared, I do have that note from Delegate Keys Gamara, so I think we're good. So basically, we accept your substitute, then we'll do the same on the Senate side.
Correct. She's going to offer the exact same on the Senate side, and that's
Okay.
what we will adopt on the Senate side. So we'll be fine.
Yes, please, yes.
I just want to ask,
Sure, Hope.
why did you make the version more narrow? We had the support here for a broader look. Why did you and
Actually,
decide to narrow
the
it?
hospital community and the Medical Society of Virginia wanted it to track with just the oil right now because they didn't
Okay.
want to get in trouble with the Federal Controlled Substance Act. And the hospitals are also receiving federal funds, both a Medicaid match as well as Medicare, and they were afraid that some of their federal revenue sources
All right,
could
well,
be
I'm
at risk.
comfortable with that response. All right. I would move to report to substitute.
Thank you.
We have a motion that's been properly seconded to report with substitute SB 332, and we will go on the board for that. And that reports with substitute by a vote of 19-1. Senator Villa, thank you so
Thank
much for
you.
getting that to where it is. I really appreciate that.
Thank you. Thank you all. Have a good day.
Thank you. I need to look at one. If we could hold tight, we're going to go at ease just for a moment. We have to look at a couple of votes. So hold us 1 second. We'll be at ease. Bring us back to order. We just got a note from appropriations about a conformity issue on Senate Bill 308. And so we're going to need to send that up to appropriations to get that straight.
Right.
So I'll take a motion.
Mr. Chairman, I do have a motion. I would move that Senate Bill 308, by which we voted to approve, that having voted on the prevailing side, that we approved House Senate Bill 308. I ask that we reconsider that vote.
Second.
We have a motion that's been properly seconded to reconsider the vote on House, I keep saying House Bill, Senate Bill 308. All in favor of that reconsideration, say aye. Aye. Any opposed? No. Okay, so that's back before us.
Okay, it's going to take me a minute.
Second.
We're going to pull it up. So we have a motion that's been properly seconded to report with substitute and refer to appropriations, SB 308. And we will get that up. We had to bring that up again, so we'll pull that forward
It has a substitute.
with a substitute.
All right, let me see if I can do this.
Okay.
If not, I'll have to figure it out. I hope so. Keep your fingers crossed.
And that's before us. Here we go. We go on the board. There it goes. Okay. And that reports will be referred to appropriations by a vote of 19-0. Thank you very much, committee members, this morning. I'm going to look at Delegate Prince. Are we good to go right to health professions? So we will adjourn this meeting and then go right to health professions. Thank you so much, and we are adjourned.